Scheuermann's kyphosis is a structural spinal condition that typically develops during adolescence, affecting up to 8% of teens. Unlike postural kyphosis, this disorder is defined by vertebral wedging and a thoracic Cobb angle greater than 45 degrees. The changes are visible on X-rays and are often accompanied by features like Schmorl's nodes and in-plate irregularities. While it can cause noticeable rounding of the upper back, many people may not realize they have it until a doctor points it out. Understanding this condition is crucial for families and patients, as it sets the stage for decisions about monitoring, treatment, and long-term expectations. Medical community began to define Scheuermann's kyphosis in the 1960s, with Sorensen's criteria requiring at least 3 adjacent vertebrae with 5 degrees or more of wedging. Early studies found that about half of affected teens experienced back pain during growth spurts, but this pain often lessened after reaching adulthood. Most pain was mild and not disabling, leading some to believe the condition was relatively benign after growth. However, later research suggested that outcomes could vary, especially for those with more severe curves. By the 1990s, researchers began tracking patients with Scheuermann's kyphosis over decades. A pivotal study from the University of Iowa followed patients for over 30 years, revealing that while those with SK reported more back pain and slightly reduced trunk movement than their peers, their overall quality of life was not dramatically different. Most patients maintained normal educational and work participation, and only those with extremely severe curves experienced significant lung issues. These findings suggested that, for most, the condition does not lead to major disability. Modern studies from Finland, Denmark, and the UK have used large cohorts and advanced health metrics to further clarify the natural history of Scheuermann's kyphosis. These studies consistently show that while adults with SK are more likely to experience chronic back pain and some activity limitations, the degree of spinal curvature does not reliably predict who will have the most pain or disability. Most patients report only mild to moderate symptoms, and significant life interference is uncommon unless the curve is very large or there is forward imbalance. One of the most important findings is that Scheuermann's kyphosis tends to progress slowly, even after skeletal maturity. Studies tracking patients for up to 46 years found that the curve increases by about 0.3 to 0.5 degrees per year. For example, a curve measuring 60 degrees at age 18 might reach 70-75 degrees by age 50. However, not all patients progress at the same rate, and most never reach the extreme curvatures that cause severe problems. Predictors of progression remain limited, making regular monitoring important. Most adults with untreated Scheuermann's kyphosis, pain is the most common complaint, but it is usually described as intermittent and manageable. Physical function is only mildly reduced, and most people are able to work, socialize, and participate in daily activities without major limitations. Only those with the most severe curves or significant forward imbalance tend to experience notable physical limitations or require lifestyle adjustment. This means that, for the majority, the impact on daily life is less than the X-rays might suggest. Recent research has shown that radiographic size alone does not predict symptoms. Instead, the combination of spinal deformity and loss of global alignment, especially forward sagittal imbalance, better signals which patients are at risk for pain and disability. Patients with a forward-shifted posture are more likely to report pain and functional difficulties. This insight helps clinicians focus on alignment and compensation, not just curve size, when planning follow-up and treatment. Serious complications like lung or nerve problems are rare in untreated Scheuermann's kyphosis. Only those with extremely large curves over 100 degrees are at risk for restrictive lung issues. Neurologic symptoms are uncommon because the deformity rarely compresses the spinal cord. Most patients, even with moderate to severe curves, do not experience major respiratory or neurologic compromise, which is reassuring for long-term health. Summary: Scheuermann's kyphosis is a common adolescent spinal condition that usually progresses slowly and causes manageable symptoms for most people. While adults with SK are more likely to have back pain and mild functional limitations, severe disability is uncommon unless the curve is extreme or there is significant imbalance. Conservative treatments like physiotherapy and bracing are effective for most, with surgery reserved for rare cases of progressive imbalance or persistent discomfort. Understanding the natural history of SK helps families and clinicians make informed decisions and set realistic expectations for lifelong health.